it is 12:30 now here on a Friday. Hello, Brian.
Hey, you can never have enough Brians.
You cannot, yeah.
Except for tonight on the drive home. Well, listening for that, too.
That's true, yeah. We'll have even more Brians on then. So, yeah, 2 Brians. And we got 2 doctors with us today.
Hey!
We got 2 doctors. We got Dr. Ryan Jennings and Dr. Millie Nelson with us.
Hey,
Hello.
guys.
Good afternoon.
How you guys doing?
Good.
Yeah, you're here to talk a little bit about, we're talking about the vaccine, talking about COVID and all that stuff. Where do you want to start? You want to start with the vaccine?
Yeah, let's start with the vaccine.
Yeah.
I think that's the hot topic.
It's a big one.
That is a big one, yeah.
A big one. Hey, great news, really. We're still edging up our numbers as far as percent vaccination within Effingham County. We're up around 40% now, so that's fantastic to see folks getting out and getting the vaccine. From what we see in the hospital perspective, if you look back compared to the peak prior to the Delta variant, this one's not peaking as high, and that's because of the vaccine, and especially because although there's 40% of the total population vaccinated, the over 65 population in the county is very heavily vaccinated, 80% or so.
Wow.
And so we're not seeing that elderly population like we did in the first go-round. The bad news is that means those folks that are in the hospital are too young to be in the hospital. They're young, they're healthy, and this thing is so severe that it's landing them in the hospital, which is sad to see. So hopefully we can continue to encourage the vaccine. Amazing efficacy and very few reasons not to get it. The reasons to not get it are extremely slight. But part of the reason I brought my good friend Dr. Nelson, who is OBGYN as well as the president of our medical staff with us, was one of the things that we hear a lot about is concerns about the vaccine related to pregnancy, breastfeeding, those types of things. And we've got great news on that front, but I wanted to hear it from an expert.
Aha.
Oh, my
Dr.
goodness.
Nelson, enlighten us.
No pressure. No
This
pressure.
is a hard act to follow, Dr. Jennings.
Enlighten us, doctor.
So I am a general obstetrician gynecologist, and I can read about the concerns of COVID and pregnancy, but I have had to live that this last month.
I bet.
And I cannot encourage all pregnant women enough to get the vaccine. It is recommended in pregnancy. It does not cause infertility. It is recommended at any stage of pregnancy, and in fact, the earlier you get it in your pregnancy, the more likely there will be a higher antibody level in your infant when it is born. The risks of COVID in pregnancy are significant. So if you get COVID while you're pregnant, you're more likely to get sicker. It can cause your baby to die. It can cause your baby to stop growing. It can cause you to have preterm delivery. It can cause you to have preeclampsia, which is a blood pressure problem in pregnancy. And we've seen in Effingham at St. Anthony's all of these problems occur.
Whoa.
Wow.
Just a couple of weeks ago, we had a woman who basically almost needed to get intubated from COVID. And it is not a pretty disease in pregnancy.
Well, and pregnant women are young and healthy.
Yeah.
So you don't expect them to suffer with such a severe illness. And the vaccine, remarkably effective. So can't say enough good things about it.
No, and the vaccine will cause your body to make antibodies that cross the placenta and protect the baby.
And we've even seen it through breastfeeding having positive benefits as well. So those same antibodies can cross over and protect the baby in those first very fragile months of life. So development of antibodies is really essential to protect the mother and the baby. And so that's great news that we've got some resources now that we hadn't had previously.
So if a woman chooses not to get vaccinated in pregnancy, the other thing that I will talk with them about is how important it is to mask and how important it is to physically distance yourself. And you have to make choices about not going in social groups that are close together, like weddings and things like that.
Sure.
You have to make a choice when you're checking out of the grocery store or Walmart to put distance between you and the person in front of you. And you have to make a choice to wear that mask over your nose. And for pregnant women, that's difficult because they already have some difficulty taking deep breaths.
Oh.
Yeah.
I also counsel my patients that if you develop symptoms of COVID, don't wait to get tested. Get tested immediately, because there are things that we can discuss with you that you can do that may help you not be that sick person that went to the ICU, or that sick person who whose baby died when she was
Right.
8 months pregnant.
Yeah, definitely.
So one of the myths that we get, or one of the questions that we often get is, why do we hear about people that have been vaccinated getting the disease? And it is true. We definitely see breakthrough cases, and that's part of why you're hearing conversation about the booster shot. But like every other thing, the vaccine's not 100% effective,
Sure.
but it's darn near 100% effective at keeping people out of the hospital, out of the ICU, and off the ventilator.
Yeah.
So kind of like the flu shot from year to year, you may get the flu, but you tend to get it very mild. The people who've been vaccinated and then develop COVID, they're sick a couple days, maybe not even sick at all. They just got tested for some reason, and they just don't end up in the hospital. So your risk of death is over 1,000 times more likely if you're unvaccinated than if you're vaccinated.
Whoa.
Yeah.
And if you looked at the numbers, if that weren't true, then you would expect 40% of our patients in the hospital to be vaccinated and the other 60% to not. And in fact, that's not the case at all. It's only about 5 or 10% of the patients in the hospital that have been vaccinated. And usually they've got something else going on that maybe made them not respond as well to the vaccine as you could have. So. And the one thing Dr. Nelson hasn't mentioned is hand washing. Every time I'm on here, I'm a big fan of hand washing.
Exactly.
Long before COVID came around, we were preaching hand washing, and that hasn't gone away one bit.
Yeah.
The other thing about, the vaccination and immunity, it takes time after you receive the vaccine to become fully immune. So if you do the two-step vaccine, you probably aren't fully immune till at least 2 weeks after that second dose. So some people, finally decide to get the vaccine and then a week later get COVID and go, oh, see?
Yeah.
Well, you have to give the vaccine a little time to work.
Yeah. Build up the antibodies, I guess.
Exactly.
Correct.
Yeah.
There are people who think that or espouse and are resistant to getting vaccinated because they think that the COVID vaccine will cause infertility. That has not been shown. And there are people that are averse to getting the vaccine early on in pregnancy because they feel it might contribute to miscarriages. That has not been shown.
Yeah.
There is no reason not to get vaccinated in pregnancy.
Yeah. Definitely.
Well, millions of doses. I mean, I know when it first came out, everybody's going, man, this is brand new technology. Well, it's not new technology anymore. And, hundreds of millions of doses later, it's just been incredible, the experience with especially the mRNA vaccines, the Pfizer and Moderna vaccines, just almost nothing. Even compared to things like the flu vaccine that we routinely don't think anything about. So, and speaking of that, we're almost on flu vaccine.
Yep.
It's coming up, man.
Yeah, I was going to say, when's that start usually?
Well, flu season, we held like no flu season last year.
Yeah.
And I think some of that was masking. I'm going to give it all the credit to hand washing. It was all about me telling everybody to wash their hands. But between masking, hand washing, distancing, those types of things, we had almost no flu season. So we're kind of expecting it maybe hit a little early this year.
Okay.
So vaccine clinics are already started up in some areas. We'll be starting vaccinating our own colleagues and things here just right at the end of the month. And it's a four virus protection, 4 strain protection vaccine this year. We're also at the same time talking about COVID vaccine, and there's absolutely no problem with giving both the COVID vaccine and the flu vaccine at the same time.
Okay.
Generally speaking, with vaccines, we do that all the time anyway. When you think about all those childhood vaccines and things, they've got multiple things in it, and the body does a great job at responding to all of them.
Yeah.
So after
get your flu shot and wash your hands.
Exactly.
After you get the COVID vaccine, Dr. Jennings, how long is that vaccine in your body?
So it's only there a matter of weeks,
Yep.
and yet the immune response sticks around a long time.
Mhm.
And but we're seeing, folks' vaccine immunity tend to wane, maybe around the 6 to 9 month mark, and so that's why you're starting to hear conversations about the booster. And then, of course, most recently, the FDA did approve the Pfizer vaccine for people over the age of 65 and those that are at high risk or in high risk environments to receive a third dose 6 months after their completion of their initial series. So, and we expect Moderna will follow that as well. Hopefully, what we're going to see is those vaccines get modified, kind of like the flu vaccine does, so that then it's going to have the Delta strain as part of it, or the Lambda,
Yep.
or the Mu.
Yeah.
So, we'll see. Unfortunately, I don't think that we're going to have a great day where we all say COVID's left the earth.
Yeah.
We're going to be dealing with this.
So I get this question a lot, Dr. Jennings. I had COVID. Should I get vaccinated?
That is such a great question because there's a lot of conversation about natural immunity.
Yeah.
And, natural immunity is real, but actually what we've seen in the studies is the vaccine itself, if you've not had COVID, is more effective than native disease. So, but the best protection, oddly enough, seems to come from folks that have had the native disease initially and then got the booster as well, got the vaccine as well. That probably has to do with the vaccine being more broadly protective against the variants, and then you've still got great protection from the alpha strain originally. Now that we've got the Delta strain being the prevalent disease, we'll see how that evolves over time. But the vaccine clearly offers additional benefit.
Excellent. Now, what about other treatments they're talking about? These other things that they're talking about.
Yeah.
So one of the reasons I encourage my pregnant patients to call me immediately when they start having symptoms and then get a COVID test to confirm is because it is now recommended that if you're in the first 10 days of your disease to get a one-time infusion of monoclonal antibodies.
Okay.
So we are sending patients for that
Okay.
infusion. And just anecdotally, I have seen it make a difference.
Okay. Excellent. Yeah.
Yeah.
Unfortunately, the monoclonal antibody is not nearly as well studied as the vaccine. So, that's pulling in your second line of defense when
Sure,
your first
yeah.
line of defense was getting vaccinated, and certainly lots of data around it. So, let's not miss the front line and then think the world will save me on the back end.
Yeah.
Let's do it right and get vaccinated.
So the other point, a lot of people think the vaccine is going to cross the placenta. It's not the vaccine that crosses the placenta and gives antibodies to the baby. It's the antibodies that you make against the vaccine that cross the placenta and protect the baby.
Yeah.
And then a lot of people ask me, I have an immunocompromised condition, doctor. Should I get the vaccine? What do you tell them, Dr. Jennings?
They are the exact folks that need to get the vaccine because they're the ones that are highest risk if they get the disease to do badly. In fact, those folks are the ones that instead of a 2-shot series, it's actually recommended right out of the gate to receive a 3-shot series. So some of those folks that have had an organ transplant or receiving chemotherapy or on chronic medications that suppress their immune system actually need to make sure that they get the vaccine and get the 3-dose series right out of the front, right out of the gate.
How about like people like myself? I have diabetes. Am I recommended to get a third shot then?
Not yet.
Not yet, okay.
Not yet. Now, you are definitely one of the people that the booster conversation,
Okay.
so the 6-month mark is when you definitely are a candidate for that.
Okay.
The true 3-dose series right out of the gate is really reserved for those folks with severe immune compromise. Like I
Okay.
said, more the organ transplant crowd and that type
okay.
of thing. But the CDC guidance specifically around the booster still pending a little bit to get to other risk factors like diabetes, those types of things. So we'll be hearing more about it.
Okay. Excellent. So, I need to get things wrapped up here. Anything else you guys want to talk about real quick before
I would just say that
wrap up?
COVID is very prevalent in Effingham County.
Mm-hmm.
And it's really to the point where when I see a patient today, they don't have a personal experience of a friend or a family member who's had COVID
Mm-hmm.
and a friend or a family member who's gotten very sick from it.
Yeah.
And just this morning, I had 2 patients get diagnosed with COVID, OB patients.
Oh wow.
And this is becoming really a daily event. because they're that young population,
Mm-hmm.
you know, that didn't get vaccinated but go to a wedding or, you
Yep.
know, go
Yeah.
to a public gathering and
Yeah.
want to go have fun. And it's here.
Yeah, yeah, definitely, and hopefully, like you said, we're probably not going to get rid of it anytime soon, but we need to deal with it
That's
the
right.
best we can, I
And
guess.
we're glad you guys are able to come in and clarify some of these things to an audience. I can only imagine how many questions you two get
Yeah.
on a
There's
daily
few, and
basis.
especially, you know, with the executive order and the federal
Yeah.
mandate and those types of things, that's raising a lot of questions. You can always reach out through our website. There's an Ask the CEO spot, and when you ask the CEO asks me. So, so feel free to use that anytime. Be happy to chat. And otherwise, you know, please get the vaccine, but just as importantly, wash your hands.
That's right. Wash your hands
Right on.
Wear your mask
and wear your
That-
mask. That's right.
and keep 6 feet behind the guy ahead of you at Walmart.
That's right. Exactly. So, all right. Well, Dr. Ryan Jennings, Dr. Millie Nelson, thanks for stopping by and talking to us today.
Hey,
You're
thanks
very
for getting
welcome.
us on. We really appreciate it. We really appreciate it.